These days, we get asked by a lot of patients whether we have non-surgical options for surgeries like a facelift, a neck lift, a chin implant, or a rhinoplasty even. So, in this video, we are going to explore the different options that are available to us for all of these different kinds of surgeries. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon, director of plastic surgery at Skinzone Aesthetics in Mumbai. So as people get older, they start seeing a bit of sagging. They start seeing a bit of unevenness of the skin and sagging and looseness of the skin and wrinkles developing. They see sagging of the eyelids, they see some wrinkles on the forehead. So one thing that a lot of people come and ask us is what can be done. Say if you're in your 60s, in your 70s or in your 80s, probably the only thing that we'll tell you is a facelift or a neck lift because nothing else really corrects it. But maybe if you're in your 50s or in your early 60s and you have good tone in your skin, perhaps we can offer you some non-surgical options. Of course, for our younger patients, we will always offer them. What do these include? First, if you have a lot of sagging, we can do what is called as a tread lift. Tread lifts can be done for your eyebrows, where we can lift your eyebrows. It can be done for your cheeks, if you have a lot of laugh line and a lot of sagging over here, where we lift it like that. For your jowl areas, if you have these sagging there or the jaw line is not very defined, and we can sort of lift that. Or we can also do it for your neck, we can sort of lift that if you have started to having some loose sagging skin for your neck. Now what is a tread lift? Tread lift is basically a tread which has small barbs in it, which we put through a small needle through under your skin. It latches onto the fat underneath your skin and helps pull up that entire area. It has a downtime of about 5 days. It may have some bruising and some swelling, where the patient may look like it has been stretched. Initially they will feel everything has been stretched and tight, and usually in about a week's time everything sort of relaxes and they get pretty good results. We don't use permanent threads, so they are available in the market. We use threads which are basically PLL ACL threads. These are threads that usually last anywhere between 1 year, and if they are HA coated or HA impregnated, that also helps with the skin quality, that is skin quality issues that are there, and they may last a little longer. However, tread lifts are not an option for patients who have a lot of loose skin or issues with deeper structures such as their fascia or bone. Now, if you have issues with bone resorption, so what happens with aging is that the cheekbones and the jawbone, they both go in. This also increases the amount of fat, that is deep fat, that sort of just falls down. For correcting both of these, we can use what are called as fillers. Fillers are filling agents. We use what are called as HA fillers and sort of help give more bulk and volume to the face, which helps rejuvenate it and make it look younger again. It is especially useful in areas, instead of facelift, in areas such as your under eyes, your cheeks, your jawline, sometimes to contour them, sometimes even for the chin instead of chin implants. So yes, instead of chin implants, we can use fillers. Threads, another area where threads and fillers are useful, are in place of rhinoplasty. So if you say having a small hump over there, if you want a little bit more definition in the center, or you want to raise the tip slightly, then probably things like a tread lift or a filler may be useful for you. Then you may not require a complete rhinoplasty. However, if the sides need to be changed, if it needs to be narrowed, or other major changes need to be done for your face, rhinoplasty would then be your only option. In areas such as your neck or your forehead, if you're having some wrinkles, if you're having some bands that are happening, maybe things like Botox can work. Botox helps basically the wrinkles on your forehead, your eyes, the crow's feet, the glabellar lines. It can also help decrease what are called as these masseters. Earlier we used to do what is called as a surgery, where we would denervate the masseter and they would decrease in size if somebody has very big masseters. That can now be done with just Botox and you don't need any denervation. So Basically, a lot of the facial surgeries, especially in younger ages, or if you require minimal treatments, can be taken care of using threads, fillers and Botox. There are other treatments such as RF, which is radio frequency. There is heating up of the skin using lasers, and all of these treatments can help with the overall improvement as well. So we as doctors here at Skinzone use both surgical and non-surgical things to help our patients out, not just with giving them a look that would be a major change, but even with subtle changes that these non-surgical procedures may help them with.